Meet Annie. She suffers from terminal lung cancer and only has a few months left to live. She wishes to spend the rest of her days at home with her family. Like Annie, 90% of Canadians have indicated that they would prefer to die at home, yet only 30% of Canadian deaths occur at home. So why do only 30% of Canadians die at home? Well, based on research, this is due to the patient and family's inadequate knowledge of palliative home care and available resources. Each individual has a unique story as to why they wish to be treated at home. Most commonly, they wish to die at home because the home environment provides a sense of familiarity, comfort, and safety. It's easier for their loved ones to visit and provide more open space to have as many people as they wish at the time of death. It also allows for more emotional support and shifts the focus away from the medical aspect of dying. Therefore, by providing adequate resources and quality palliative care, Annie's wishes will be met and she will be able to have a meaningful and peaceful death at home. In providing quality palliative home care to Annie, open and honest communication is important between Annie, her family, her extended social network, and the healthcare team. Open communication between Annie and her family allows for a shared understanding of each family member's roles, which could prevent feelings of resentment and anger within the family. Annie can identify the members of her extended family and seek support in those she feels comfortable with, which could help her reduce feelings of isolation. Maintaining ongoing communication with the healthcare team throughout Annie's palliative journey is important for making adjustments to Annie's plan of care according to Annie's wishes. Members of the healthcare team may include doctors, nurses, social workers, spiritual workers, and personal care workers. Once open communication has been established, the healthcare team and Annie can begin to discuss the components of palliative home care. There are a few home resources that need to be equipped in Annie's home, including a hospital-type bed, wheelchair, oxygen tanks, and raised toilet seats, all of which can be provided by the Continuing Care Services of Nova Scotia Health Authority and the Red Cross. The palliative care coordinator can set up an in-home visit to complete an assessment of Annie's home and identify and inform Annie and her family about various services that can help provide the home resources needed for palliative home care. It is important to have Annie and her family identify a designated caregiver who must be familiar with her needs, provide appropriate care, and serve as the point of contact for the healthcare team. The palliative care team can spend time with Annie and her family to provide them with information that will be helpful in transitioning into palliative home care. The family and caregiver should also be familiar with the common physical symptoms that Annie may experience close to death, such as pain, shortness of breath, confusion, and chest secretions. The healthcare team also needs to inform the caregiver about when and who to contact for help, such as 211, 811, 911, and the physician. Once home resources are in place and caregivers are identified, the palliative healthcare team can begin to identify and refer Annie to the appropriate community resources. There are various types of community resources throughout Nova Scotia. These include financial support, spiritual support, grief support for the family, and caregiver support. Specifically, the EHS provides the special patient program that allows palliative patients within Nova Scotia to access support from paramedics for pain and symptom management without requiring transport to hospital. Nova Scotia PharmaCare is a palliative care program that covers drugs needed to manage symptoms associated with end-of-life care beyond the patient's regular coverage, which minimizes financial burden for those who wish to die at home like Annie. The Government of Canada offers compassionate care benefits for Canadians who need time off work to care for a seriously ill family member by providing employment insurance. Annie is not the only one. She is one of the 90% of Canadians who wish to die at home. Home resources, client and caregiver education, and community resources are essential in achieving quality palliative home care. When these essential components of palliative care are achieved with the support and ongoing communication from the healthcare team, Annie's wishes can be met, thereby allowing her to die meaningfully and peacefully at home.